Hello, my name is Celeste Menenk, and on behalf of team number 27, I would like to introduce our project. We have been working in partnership with the Royal College of General Practitioners to build a functional prototype of a virtual reality simulation of the clinical skills assessment. The main idea of this project is to eliminate nervousness related to exam day. The Royal College of General Practitioners is the only location in the entire United Kingdom where the CSA may be held. Hence, few students have the opportunity to visit the Royal College of General Practitioners to observe the real examination environment beforehand, or even attend mock examinations or preparatory sessions. Therefore, we have intended to build a virtual reality environment that simulates the real exam conditions by allowing students to practice interacting with patients and diagnosing them in examination rooms identical to those at the Royal College of General Practitioners. The key requirements we had identified for this project were a successful simulation of the exam in terms of structure and environment. We wanted to construct a VR environment identical to that at the Royal College of General Practitioners. We also wanted fully functional timing features, as time is of the essence in this exam, and we wanted the platform to also be available for both computers and VR headsets to increase availability, as we understand that most candidates would not have a VR headset at home. The main technologies we have used are virtual reality using Unity. We also have text-to-speech and speech-to-text. We managed to implement natural language processing using IBM Watson, and we built the humanoid avatar using Blender. Here we have our system architecture diagram. So our system consists of three main inputs. One of the main inputs is the microphone input, and this is uploaded to the IBM Watson cloud to allow text-to-speech and speech-to-text. Then we have the Oculus Go controller input. So this is our VR. Oculus Go is our VR headset. So we have the controller input, and we also have the user files, which are essentially the patient scripts. The controller input and the patient scripts all go into our main code. The controller is handled with the controller script, and the patient scripts are handled by our script loader. IBM Watson and the script loader work together to read out the patient's responses. And this is also what allows the interaction between the user and the patient avatar. In our user interface, we also have scripts for the buttons and the timer, as well as user interface formatting scripts to make our interface look as good as it possibly can. All of this finally outputs into the VR headset, producing visuals for the user, as well as this also allows transcripts to be produced of the consultation that has just been held. I would now like to show you a demonstration of our fully functional features. Here is our welcome screen, and we select the first test. Now a video is playing showing the entry into the corridor where the examination rooms are. There's also a skip video button in the middle in case the user would like to skip the video. We have now entered the examination room, and the consultation is about to begin. So we have given each consultation about 1 minute to prepare, to allow the user to prepare, so they can read the patient summary or the patient file that is situated on the desk. As you can see, the timer is also on the wall, and there's an exit button on the far right corner of the desk. The room has been captured as a 360 picture, and we have just added interactive elements to this image. And now that we have read the patient file, the consultation can begin.
Hello. Hello.
Can I examine you today?
Yes, you can.
What seems to be the problem?
I have been feeling really under the weather for the past 5 days or so.
Does it hurt when you swallow?
Yes, a bit.
Can I examine your throat?
Yes, you can.
Are you breathing okay?
Breathing is normal, but my nose is a bit stuffy.
Can I examine your chest?
No chest pain.
Can I take your temperature?
I don't think I have a fever.
Any allergies?
No?
Can I give you advice on anything?
I want to take antibiotics. I'm sure this will pass sooner.
Has this happened before?
I had the same symptoms 4 years ago, and the GP said I needed antibiotics because of the chest infection I had. I am sure I need antibiotics again. I want this to get better quickly.
It can be dangerous to take antibiotics if you don't need them,
Why?
because you seem to have a viral infection and not a bacterial one.
Next weekend I'm the best man at a wedding. I don't want to cough through the whole speech. So I want antibiotics.
You should stay at home and rest, drink plenty of water, and take some anti-inflammatory medicine.
Fine, I'll do that.
Follow up in a week if it doesn't get better.
Well, goodbye.
Can I do anything else?
No, I think I understand.
Goodbye then.
Well, goodbye.
In terms of our achievements, here is a table that illustrates everything that we have achieved over the course of this year.